video for 5 minutes. That is an awareness video. And after that, we'll start our proceedings, sir. And by that time, madam will also join.
5 minutes 56.
Video for 5 minutes. हाँ जी, आपने स्क्रीन शेयर नहीं किया सौरभ?
दीपांशी, दीपांशी, मिनी मासी से नाराज है, नानी से तो नाराज नहीं है ना? चल अपनी गुड़िया को अच्छे से तैयार करती हूँ।
नानी नानी, पापा कहते हैं कि मैं घर की छोटी नानी लगती हूँ।
मेरी छोटी नानी। पता है तेरी नाक बिल्कुल तेरे पापा जैसी है। जब तू हंसती है तो माँ जैसी लगती है। मेरी सुंदर गुड़िया। और जब दूध बनाते हैं तो बिल्कुल मिनी मासी जैसी लगती है। इतनी सुंदर लग रही है गुड़िया। बिंदी और लगा दी।
नानी, मेरी आईज किसकी जैसे हैं?
क्या आप दीपांशी की मदद करेंगे? बनेंगे इसकी आंखें।
There are 45 million blind people in this world, out of which 1/3 live in India. So let us donate our eyes and bring light into the lives of those who cannot see this beautiful world.
I think we can start now. So, Dr. Sonu.
Yeah. So, respected chief guest, Madam Vini Mahajan, guest of honors, Professor Jagat and Mr. Hussan Lal, our keynote speaker, Dr. Adhika Tandon, and all live YouTube audience of the occasion. So today we are celebrating an eye donation fortnight.
So next slide. Yeah.
So eyes are the outlet of this beautiful world, and it allows us to enjoy the colorful glory of the world. However, there are few people who are not
Next
privileged to possess it, either because they are born with visual impairment or an accidental cause them to lose their beautiful sensory organ. Although these people are less talented than most of us, but still want to enjoy this beautiful nature through their eyes. So today we are celebrating Eye Donation Fortnight, where the doctors who have given these people their sights to enjoy the world, in their words, they call them Masiha, shall be honored. We are privileged to have eminent guests in form of Madam Vini Mahajan, Honorable Chief Secretary, Government of Punjab, Professor Jagat Ram, Director, Postgraduate Institute of Medical Education and Research, Chandigarh, Mr. Hussan Lal, Principal Secretary, Health, Government of Punjab, Professor Radhika Tandon, Head of the Department, Eye Center, All India Institute of Medical Sciences, Dr. Arit Kaur, State Program Officer, National Blindness Control Program, State of Punjab, Dr. Kamaljeet Rana, SPO, NPCB Chandigarh, and all our corneal surgeons who have been associated with us in this CBF movement since 2015. So I would like to start this welcome address by inviting our chief guest of the occasion, and I am handing over to Dr. Rakesh Gupta for inviting our chief guest of the occasion.
Saurabh, next, please. So good afternoon, everyone. So, ma'am, as told by Dr. Sonu Goyal, we are celebrating Eye Donation Fortnight 2020, honoring our corneal heroes. 5 years ago, in September 2015, so this corneal blindness backlog-free initiative was conceptualized by Madam Vini Mahajan when she was Principal Secretary, Health and Family Welfare. She also asked Professor Dr. Radhika Tandon from RP Center, AIMS, to help us as a technical expert. And she's still, till now, she's attached with us as a technical expert. Shri Hussan Lal, the present Principal Secretary, Health Family Welfare, he was MD NHM and Secretary Medical Education Research at that time. As an SPO NPCBVI was also associated with CBBF from the very beginning. The major gains were qualitative improvement in eye donations and keratoplasty surgeries, as there was a regular monitoring by all the high-ups. All the stakeholders, including government, private corneal surgeons, civil society organizations, paramedical staff, even police department was on board. There were some state-specific rules which were changed to facilitate eye donations, and charges for registration were reduced from 1.5 lakh to 10,000 for all the keratoplasty centers and the eye banks. So CBBF Punjab initiative was appreciated nationally and internationally. With great satisfaction, I may mention that many of the CBBF team members, they are participating in today's event, and there has been a big setback due to COVID-19. Dr. Radhika will guide us how to steer ourselves back to the path. All the corneal surgeons associated with us are doing a commendable job, and it is my proud privilege to announce the name of our cornea heroes. Next. So this is the iconic picture. I think Madam will remember. It was in 2015. It was September 2015 when we were attending a Eye Donation Fortnight program in Jalandhar, when this CBBF initiative was conceptualized. Next. So this was first or second meeting of the high-level meeting for CBBF, and most of the people, they are still associated with us. The most of the people in this picture. Next. So these are our cornea heroes. Dr. Ashok Sharma, he is from Chandigarh. He has got a private setup, Cornea Center in Sector 22, Chandigarh. Professor Dr. Shakeen Singh, he is a HOD in Shri Guru Ramdas Medical College, Amritsar. Dr. Ramesh Kumar, he is from the Punajot Eye Bank, Ludhiana. Professor Dr. Amit Gupta, he is from Advanced Eye Center, PGI. Professor Dr. Karamjeet Singh, he is from the GMC, Amritsar. And Dr. Rohit Gupta, He's having his own clinic, Tri-City Eye Hospital in Khar. So next. So can we have the next slide? So now I'll request Mr. Arun Verma to introduce our guest of honor, Shri Hussan Lal. Mr. Arun Verma, he is Director of Operations and Finance of SIPHER. He is formerly Director Distribution, Punjab State Power Corporation, and Managing Director of the Dakshin Haryana Power Corporation. So over to Mr. Verma.
Thank you, Dr. Rakesh. Good afternoon to everyone. Next slide, please. Yeah. Shri Hussan Lal ji is the Principal Secretary, Department of Health and Family Welfare, Government of Punjab. He is a 1995 batch IS officer and an alumnus of Punjab Engineering College 1984, Civil Engineering Department. He has served as a Deputy Commissioner in 4 districts of the Punjab. He has been the MD, NHM, PHSC and Commissioner FD, and has various other important assignments in the state, including Secretary PSCB, Secretary PWD BNR, Tourism, Sports and Youth Services. He was awarded President Silver Medal for the commendable job done during the census 2001. He was MD, NHM, MD and Secretary Medical Education Research when the CBVF program was initiated in 2015. I had the opportunity to work and interact with him closely when he was Secretary PSCB. He's an officer with a very, very positive attitude. He believes in 3 P's: pursue, perform and progress. He has a special quality which I'll share with you, that he always greets his visitors with a pleasant smile. But I observed during my interacting with him and subsequent my visit to his office, इनके चेहरे पे हमेशा एक प्यारी सी और हल्की सी मुस्कान रहती है. सर मुस्कुराते ये लोग आपको ऐसे पसंद करते हैं. With these words, sir, I humbly invite you to deliver your address, sir.
Good afternoon, ma'am. Good afternoon, everybody. Yeah. Am I audible?
Yeah.
Yes, sir, you are audible, sir.
Audible, sir.
Yeah. I think this is, we are looking back in the history 5 years down the line. You know, you feel so nostalgic about what, you know, started 5 years ago has become a kind of movement with the support of everybody around, you know, people we are going to, you know, make them, you know, real heroes of this program. When we started this in 2015, I think ours was the first state to start this corneal blindness backlog-free state. So I have been told after I left in 2017 March, probably by somewhere in 2018. So this was completed, that the state was declared corneal blindness-free state. So this, you know, initiative goes, the credit for all this initiative goes to our Chief Secretary now, who was the Principal Secretary Health at that point of time, and all the team which actually, you know, worked under her guidance. So, but this would not have been possible without the support of everybody whom we are going to, today are going to, you know, honor them for the tremendous work they did. And I would like to mention here the support, mentoring given by Professor Dr. Radhika Tandon in this program. Tremendous, you know, support from Dr. Tandon, and she is right now also continuously supporting this initiative. I would also like to, you know, appreciate the initiative started by Dr. Rakesh and his team. They came out with this organization's SIPHER and undertaking all those activities and initiatives which they probably, I think he thought in service he could not find enough time to do that. And after that, now he's going to, you know, devote full-fledged to undertake this work. It's a tremendous initiative. I would, congratulate and compliment Rakesh and his team and all those people who are going to be honored today. And my, gratitude goes to ma'am, who actually was the, pivot. She started this and lot of other programs. I mean, I feel honored having worked under her. Started so many programs in the health department that we were able to steer the, Department of Health in Punjab. All indicators started moving in the positive directions. And today, after 5 years down the line, we are looking at those results. So with these words, thank you very much. I'm privileged to be part of this program and movement. Thank you. Jai Hind.
Thanks a lot, sir. So now we'll like to honor, sir. Next slide, sir. So, sir, this is an award of honor for an excellent work you have done earlier as MD NHM and now as the Principal Secretary Health Family Welfare. Thanks a lot.
Thank you. Thank you.
So, next slide. So now this is my proud privilege to introduce Madam Vini Mahajan. She is Chief Secretary to Government of Punjab. So Madam Vini Mahajan is the first women Chief Secretary of Punjab, another milestone in an illustrious career which is notable for many landmark achievements. She has 33 years of experience in a host of key positions in the central and Punjab governments. She could be the only student in the country who got admission in both IIT and AIIMS Delhi way back in 1982. In 1995, she became the first women officer to be posted at DC in Punjab when she took over as DC Roper, in which capacity she carried out a total literacy campaign for which Roper received the National Literacy Award for best performance in the country. She served in the office of then Prime Minister Dr. Manmohan Singh from 2005 to 12 and handled matters related to finance, industry and commerce, telecom, IT, etc. Next. She was a Hubert Humphrey Fellow based at American University in Washington, DC in 2001. As Principal Secretary, Health, Family Welfare and ACS Health, she initiated many public health activities, including CBBF initiative, for which she has been acclaimed nationally and internationally. She also served as Additional Chief Secretary, Investment Promotion, Industries and Commerce, IT, and Governance Reforms and Public Grievance. She has been playing a crucial role in steering the state government response to the COVID crisis as Chairperson, Health Sector Response and Procurement Committee. So over to ma'am.
Thank you very much, Dr. Rakesh Gupta, and thank you to the organizers, Sonu Goyal and others. As Hussan said, this is a nostalgic moment for both of us. 5 years ago, this program started, and I think this was a unique example of a collaborative effort. The credit for this idea is certainly not mine. I must confess that before I went to that iDonation Fortnight event in Jalandhar 5 years ago on Dr. Rakesh Gupta's suggestion, I was not aware that there is such a possibility that persons suffering from corneal blindness, there is a backlog, and that a movement can be started to try and free the state from that backlog. It came up at that time because we had outstanding persons from civil society. I would like to recognize the Hoshiarpur iDonation Society led by Mr. Behel and other very committed, very dedicated people. But there was a room full of people who believed in this issue and who gave us energy and direction. And it was there then that we decided that we will make this effort. And interestingly, when I got back to Chandigarh and asked in the Ministry of Health who we could turn to for technical advice, the name that came up was Dr. Radhika Tandon. And Radhika was a year senior to me in school, well known in school as the bright girl who was one of the 35 persons all over the country admitted to AIIMS New Delhi and went on to do her MD and has now become a leading light in the eye ophthalmology world, and in particular in this subject. But we received the strong support of so many others. Dr. Amit Gupta from PGI, always part of the meetings, always brimming with ideas and energy, and so many eye surgeons from the state, our own departments of medical education and health, I remember Dr. Shaukin Singh and Dr. Karamjit and others very actively, very energetically bringing out the issues, bringing out the solutions also, because it is important to understand the issues. It is equally important to stay positive and to look at solutions, because if we focus on the solutions, we can certainly achieve a lot, if not all that we need to. So it was in that background, and it was with that support and in that spirit of solidarity and doing something for the people of the state that we move forward. And it's a matter of great pride when society joins hands with the specialists, and we all work together to fulfilling something which seemed like a dream. Thanks to Dr. Radhika's consistent support, she would come down from Delhi whenever we asked her to, gave guidance. There was such a feeling of pride when once this letter landed up from the Ministry of Health, addressed to all the health secretaries of the country, saying that the Punjab model of CBBF should be adopted by all states. So that is what Punjab is. Punjab has the potential to become a leader. Punjab has the potential to deliver. Punjab has the potential and the capacity to receive the best professional advice, to receive the best support, but we can achieve only, like I said, if we all move together. The support of professional institutions, the support of the leaders in the space, both public and private healthcare providers, was amazing. And I look forward now, under the leadership of Mr. Hussan Lal. His sincerity and commitment is known to the health world of Punjab and beyond. And I look forward to all of you continuing to work together with zeal, with hope. We are in a difficult situation today dealing with the COVID pandemic, but I'm sure we will emerge stronger, and I'm sure we will learn lessons from this. In particular, we have learned again that it is important to take the community along. It is important to give the right information and to prevent misinformation, to prevent rumors and false information being given by whether by vested interests or by unsuspecting misguided persons. So again, a message to us in this pandemic that we all need to pull together. If social leaders and if professionals work together, they can work wonders. For this pandemic also, I reach out to all of you present today to please spread the correct information, give the correct messaging. There are many in you, amongst you, who are leaders, who are respected. Please come out. For every fake message floating on social media, let's have a respected professional come out with the facts and encourage people to move for faster health-seeking solutions. In fact, in almost everything that we see, we find that the big constraint is when people don't come forward and seek early treatment, and when we neglect our own health, whether it results in lifestyle diseases or it results in delays in treatment of other diseases. So in the hope and the expectation that this example of working together to achieve results will percolate to other sectors, certainly in the health space, but all of government. I thank you again for this opportunity to be with you. I compliment all those and thank them from the bottom of my heart and on behalf of the state government, all those who have worked for this very noble task. And I wish you more energy and more capacity to work even more for the people of the state. Thank you so much.
Thanks a lot, ma'am. And we are really obliged that you have been able to join us. We know that you are too busy with all kind of meetings. So this is a token of love from all of us, the award and award of honor. So physically, we'll be delivering you in your office, but now it is all virtual.
Thank you very much.
Thank you.
I'm so grateful to all of you, and I seek your pardon now to be leaving this meeting, but I look forward to seeing the outcome of this and other subsequent discussions. Thank you so much.
Thanks a lot, ma'am. Thank you. So now I'd like to introduce Dr. Radhika Tandon. She's Professor of Ophthalmology, RP Center, AIMS, New Delhi. Academic awards and professional honors. She has got many. 1993 gold medal by Royal College of Surgeons, Edinburgh. She attended Global Eye Banking Leadership Summit, Seattle, USA. 2011 American Academy of Ophthalmology Achievement Award. 2013 Member Expert Committee for National Organ and Tissue Transplant Organization, NOTO. 2015 appointed as a technical expert, CBBF Initiative Punjab, and will always remain indebted to her for that. 2016, President Eye Bank Association of India, Vice President Association of Banks of Asia, advisory member of the Global Alliance of Eye Bank Associations. 2017, she became member advisory committee, National Program for Control of Blindness, and 2018, chairperson, NPCBVI subcommittee on elimination of corneal blindness, Ministry of Health, Family Welfare. So over to ma'am with her keynote address.
Sorry, Rakesh, I have another VC lined up, so I would like to be excused.
Sure,
Thank
sir.
you very much. I would have loved to be part of it, but have to leave for now.
Thanks a lot, sir. We will update about the proceeding. We'll update you.
Thank you.
Thank you, sir. Thank you.
So good afternoon, everybody. It is so nice to be part of this very nice function, which is being organized by the Corneal Blindness Backlog Free Punjab team. And it is really an honor and privilege for me that I have been given a chance to get to know all of you and to contribute in my own way. And I've also had an opportunity to learn so much from all of you. So therefore, I'm very, very happy that you're having this program today. So much has been said and so many good things have been shared. I'd just like to give you my little perspective today. Let me just share my presentation. I hope you can see my slides.
Yeah, we can see. We can see your slides.
Yes. So we are in a different time nowadays. We cannot meet in one big room, and but in a way, if you see, there are a lot of progress. We are able to sit in different corners and attend, and then one can, not disrupt one's schedule. So one has to look at the positive side of things. Now, see, if you really see, how do you want to look at the glass? You want to look at it as half empty or half full. So we keep crying that cornea donation is not enough, it is so less, etc. So if you look at it from the point of view of our potential, of where we can go, yes, it is less. If you look at it from the point of view of how much is needed, there also it is less. But if you look at it from a different way, if you really see from the world statistics, the amount of collections in the world, our country is second only to USA. So look at it from that point of view, it's quite a great achievement. After USA, India has the highest corneal donation and corneal transplantation. And through the course of my presentation, and all of you obviously know in the heart of hearts that India, it is not at all a problem for it to overtake USA in this. We just have to set a target and we have to proceed, and we can overtake USA without any problem. So the current status is that we are second to USA, and the way forward is that we are going to overtake USA and be the top. Now, one thing I learned from the Corneal Blindness Backlog Free Punjab initiative and the amazing leadership of Madam Vini Mahajan and Mr. Hussan Lalji and the entire team is that there is a tremendous sort of impetus or a tremendous boost which can be given to the doctors and the medical profession by a very phenomenal bureaucratic leadership and administrative leadership. And there are so many good people that we have that we just need to get everybody to work together, as Madam said. So a simple step is that we go scientifically. We look at the data and we don't get upset that the target is too high. We look at the data and we set little targets. Just to give you a simple example, when ma'am said that can we do a corneal blindness backlog free, corneal blindness free Punjab. So we realized that corneal blindness free Punjab is not easy, not immediately, because when we looked at what is blindness and what are its causes and etc., you cannot aim for a corneal blindness free Punjab. But yes, we could aim for a corneal blindness backlog free Punjab. You know what your backlog is. So initially it was decided that let's first get data and calculate the backlog. So that took a few months. After that, when you looked at the backlog, we said, now we have to get rid of this backlog and what are the things that are required. So therefore you have data, you analyze it, you interpret it, then you think. And then you plan and then you proceed. And that was the best part about this corneal blindness backlog free initiative. And again, I have no words to say how impressed I am with the government of Punjab that you actually showed that such a thing is possible. Another point I would say that as far as eye banking and corneal transplantation is concerned, yes, eye banks and hospitals are a dream team. But even this dream team gets stuck in various barriers and hurdles. And it is the civil society, the common man, plus our NGO leaders, our social workers, and our administrative leaders, the police, the Ministry of Education, all of them, if they are able to join hands with us, the situation becomes very different. And we know that everybody is very busy. We cannot expect them to spend all their energy on this. But if we give them certain key targets, for them it is very easy often, and not only to tell us how to do it, or even to ring up somebody and even get things going. Now, India is a very vast country. There is a rural and an urban area, and one should not have a sort of a mental block or a kind of a very rigid attitude that aisa hi hona hai ya yehi theek hai. Because if we talk about hospital cornea retrieval program, that is very good, but it is better to focus that in the urban areas. But at the same time, the rural areas, it may not be very practically feasible to encourage donation from all the farmers or all the residents in the rural areas. But what we can do in the rural areas is help the people there to avoid the injuries and avoid the infection, so that the people in rural areas are not burdened unnecessarily by avoidable corneal blindness. So for the rural areas, we need to have a different focus. It should be on prevention and also quick provision of medical care so that their eyes can be saved. So modernization, is there a new way, and can we think out of the box? And there is no doubt we can. So even in the rural areas, internet is going everywhere. One can have a helpline system where if anybody gets an eye injury, they link up with the hospital and the hospital will give them advice what to do so that they don't reach the stage of requiring a corneal transplantation. So we need to have a new outlook, look, learn, adapt, and proceed. And one has to realize that we are, after all, not a very wealthy country. We are doing well, but we have limited resources, and there are so many things that those resources have to be used for. Let us look at our existing infrastructure. We have so many good medical colleges where staff is there, the facilities are there. We need to energize them and get them passionately involved and see what they can contribute. And then, of course, we have eye banks. They may be associated with hospital. There may be standalone eye banks. And everywhere we should have flexibility of resources, use innovative means, try to have public-private partnerships. We mustn't forget the fact that we require 100,000 transplants. We were supposed to cover that by 2020. And the actual transplants were only about 30,000, though the donations were higher. So 30, 40,000, they're quite target. If you look at the general scenario for the country, as president of I-Bank Association of India, I had encouraged that let us, using the Punjab model of a corneal blindness backlog-free initiative, it sort of motivated me to say that let us aim at least for eradication of avoidable corneal blindness. So we start a Miracle by Dream in India. What is Miracle? Miracle means a mega initiative for the eradication of corneal blindness eventually by dream, digitization, re-energization, education, advocacy, and multitasking. And in this, one step is that we start to get rid of the backlog of surgically treatable corneal blindness. This can be started. We need to have a list of patients who require surgery. We need to calculate how many corneas we need. And then it gives people also a very specific motive that I need to arrange at least 1 or 2 corneas per week for this area. For the other area, I need to arrange 10 to 20 corneas. And once you know that, it gives even the social worker and the healthcare worker or the grief counselor a little bit more targeted approach. So they should have the knowledge of what they are doing, how it can change somebody's life. They have to have the right attitude. We have to have a good responsiveness. Now, for example, if somebody in a hospital wants to donate the cornea, there has to be a nearby eye bank which is going to respond quickly. In case there is no nearby government eye bank available, then one should have a tie-up with the private eye bank or the district hospital. So we really need to map everywhere out that if somebody wants to donate the cornea, particularly in urban areas, I understand that rural areas may not be possible, but let us focus on the urban areas providing the cornea and rural areas avoiding the blindness. Information-based, one can use all the technology, keeping in view the safety, values, communication, and analytical and problem solving. Now, what happened during COVID? COVID has definitely created a setback because the virus spreads in the body and it enters the body via the respiratory system, the nose and the mouth, but also the eyes. And there is a fear that the virus may be active in the tear film and the surface of the cornea. And even if not present in the tear film and surface of cornea, but in approaching the dead body, if it was COVID positive, that there would be a risk to the eye bank team. So initially, there was a stop to eye banking because the country was coming to terms with the situation. But to give due credit to the entire country, we have made a lot of progress in the last 3-4 months. We now have adequate PPE, we have adequate masks, we do have adequate knowledge. So now eye banking can be restarted. So as we have started with the lockdown where everything was completely stopped and there was a phased reopening. Similarly, for eye banking, as we see, all the various eye banks have had a dramatic drop in their performance of this year's 6 months compared to last year's 6 months. But this is not something to be very upset about. After all, COVID is a very serious situation, but we will look forward to now bouncing back up. So giving you examples of various eye banks, some have dropped by 50%, some have dropped by 40%, some have even dropped by 87 or 88%. Basically depending upon what was the COVID situation or the pandemic situation in that part. So if you look at these cities like Delhi, Mumbai, Bengaluru, Chennai, Coimbatore, Madurai, Hyderabad, in these at the status when they were having more than 600 new cases per day, these are the places where the eye banks have had a dramatic drop, and that is expected. Now, looking at the initial figures from Punjab, for example, at a stage when Punjab was having less than 100 cases per day, there was a decrease of only 8.4% in the collection and 2.5%, in fact, increase in transplants. The increase in transplants was basically because there would have been more therapeutic cases and they were able to supply people who may have not been able to get operated in other places. There was a 55% decrease in collection and a 59% decrease in transplant. So this is the data from Punjab. So you can see how Punjab is doing a very good job in controlling the number of cases. And at that time, when they were in the green zone, it was possible for them to continue the eye donation and the collection activity. Surgical utility during the lockdown period, the routine optical keratoplasties were put on hold and only emergency therapeutic surgeries were done. So as you see, the utilization, the number of therapeutic cases have increased, which correspondingly increases your cornea utilization rate, because earlier a lot of corneas were discarded because they were not good for optical purpose. But the moment you increase your therapeutic cases, the not so good corneas also get used. And different examples from all over the country, where depending upon where the pandemic was at that time. So for example, in Hyderabad, there were 0 cases in April. In Delhi National Eye Bank, it was 0 in April, May and June. And now we have restarted. In Chennai, it was a little bit later. It was 0 in May and June. So as and when, wherever the pandemic was raging, that time the collection activity had dropped to 0. So we have now better knowledge, we have gathered information, we have resources and implementation. So now one can approach the donor families and one can go ahead with eye donation and corneal transplantation with safety of the staff, taking care of PPE, masks, etc. I would like to thank all the people from the various eye banks, Dr. Arif from Government of Punjab, who shared the data. I'll just give you a little snapshot about the surgeon's perspective, simply again, because to motivate people for donation, Dr. Rakesh said that we still need to motivate people to get back and to still continue the activity of donation. Now, as far as keratoplasty during the COVID time, when all routine surgeries were stopped and only emergency cases were going on, so there was a case of case selection, donor tissue and surgical considerations. And at that time, emergencies were people who had perforations or melts, painful bullous keratopathy. These are even presently, these are the keratoplasties which are considered that it is safe to do, or it is sort of justified to do. And very routine surgeries still should be postponed as far as possible. Routine surgeries at the moment, not many people are doing. Donor tissue, this is another very interesting thing, that optical grade tissue is kept in MK or cortisol, which has its time limit of about 2 weeks. However, after when we found that there were no more tissue available, we actually had to use the glycerine preserved corneas. And we also in many cases had to use the patient's own tissue in the form of Tennant's patch graft to protect the eye when there was a shortage of corneas. And then surgical considerations, all the recipients or the people undergoing surgery, they are screened for COVID. If an antigen test is negative, it has to be confirmed with an RT-PCR. And the moment they have symptoms, of course, they have to undergo RT-PCR. Now, looking at the type of surgery, because there was a drop in the high quality corneas that we were getting, so DSEC and DMEC are hardly being done all over the country. A few cases have started again since August onwards, but PK, LK and patch grafts are going on. OT arrangements, again, it took time because earlier we wanted to save the PPE for people who are running the battle of COVID. So we did not want to consume the PPE when it was unnecessary, but now by September, there is no shortage as such. So therefore, all precautions have to be taken in the OT using, if it's a known positive, then it has to be operated. If it's an emergency surgery in a known COVID positive patient, it has to be operated in a dedicated COVID hospital and a dedicated COVID. Just giving a quick presentation, a 10-year-old child had trauma with a fingernail 5 weeks ago, had watering redness and pain and an opacity for a month. He had complained of diminution of vision 1 week after the injury. He consulted multiple doctors, visited multiple hospitals, and was finally referred to us for keratoplasty. But the patient came right in the heat of the pandemic. The vision was very poor. There was a definite infection. There was a melt, iris prolapse, pseudocornea formation, and the surgery was planned as a patch graft under GA. This was a situation when there were no fresh corneas available, so we had to use a glycerine preserved cornea. In interest of time, I'm not showing the video. So that this is what the patient looked like using a glycerine preserved cornea. Post-operatively, the eye was saved, the patient was comfortable, the AC was formed, and the patient regained a little bit of vision, and later on we will be doing optical keratoplasty. This is another example of a patient who came post-DSEC, stopped medication, and even though we were giving telemedicine services, still often the patients were not able to come on time. because they were having lockdown, they were not able to move from one place to the other. Similarly, another case of chemical injuries, so emergency keratoplasty had to be done using a glycerine preserved cornea. And here we have an example of a lamellar surgery done using a glycerine preserved cornea to help a patient who had a chemical burn. So glycerine preserved cornea has come to our help, and in future I will encourage that if there is any tissue which is not used within the time limit of its medium, it should be shifted to glycerine, because the benefit is it can be used in such emergency situations in far off locations. It can be kept at room temperature, and it can be kept up to a year for emergency cases. So instead of discarding the corneas, one should supply them to the medical colleges at least, so where they may not have an eye bank, so that at least the surgeons there can help the patients and do the timely surgery instead of the person losing the eye and become no perception of light. So we had many examples of patients presenting late. They had endophthalmitis, corneal melting, choroidal detachments, retinal detachments. So if all these patients can be taken care of sooner, it can avoid such devastating damage to the eye. So patient follow-up issues were there after surgeries. We were helping them with telemedicine. Non-compliance with medications was also there due to lack of accessibility during lockdown, but the situation has definitely much improved. So I would definitely say that the Corneal Blindness Backlog-Free Initiative of Punjab is fantastic, and it is really remarkable what you all have achieved. And one has to continue and together. And of course, I wish you all the very, very best. And I really appreciate all your working together, the government, the private, the eye banks, the community, as well as the corneal surgeons. This kind of collaboration has to succeed, and this actually should be a model. One has to let go of one's own ego that I did this and you did that. It has to be as a team, and one has to target that there is no reason why any person who requires a cornea should not have it when it is required.
So thanks a lot, ma'am. And it was a wonderful presentation. And hopefully the COVID situation, which we have seen the setback to the eye donations and keratoplasty surgery, but after this meeting, I think something good will come out of it. So thanks a lot. So now, so an award of honor for Madam. She has been our technical expert for 5 years, and hopefully she'll continue to be with us always. Yeah.
Thank you so much. Thank you.
This is a token of love from all of us.
Thank you.
Yes, Saurabh. So now we'll like to honor our cornea heroes from Punjab and UT Chandigarh. So since Dr. Reet, SP NPCB, she's not with us, so I'll introduce each one of us. Dr. Jagat sir, so I'll request you to honor each of our cornea heroes. Okay, sir. So next, so Dr. Ashok Sharma, he's Director Cornea Center Chandigarh, has more than 30 years of experience in eye banking and cornea transplant surgery. He was instrumental in establishing Eye Bank Society Chandigarh and was facilitated by the Doom Society and given state honor by Mr. Dhumal, then Chief Minister HP, for his outstanding contribution to the field of eye donation and cornea transplant surgery. So he has been awarded Achievement Award by American Academy of Ophthalmology. He has developed major expertise in cornea grafting in children. He received Best Poster Award in American Academy of Ophthalmology meeting at Chicago, USA for his work in cornea transplants in children. He has delivered guest lecture on cornea grafting in children in Middle East and African Society of Ophthalmology Conference of Bahrain. So we are honored, sir, to honor you as our cornea hero. Next.
I think congratulations to Dr. Ashok Sharma, who has done outstanding work in the field of eye donation and keratoplasty, and he has also outstanding poster in American Academy of Ophthalmology. Congratulations, Doctor.
We can all clap for him. So we can all clap for him. We can unmute ourselves and clap for him. So next. So Professor Dr. Shakeen Singh, he is HOD Ophthalmology, SGRD Medical College, Amritsar. He's also medical director, Dr. Shakeen's Eye Dental Hospital. He's president, Punjab Ophthalmological Society, North Zone representative, Eye Bank Association of India, NABH technical expert, and he's also chief editor of the Tropical Ophthalmology. Special recognition state award by Punjab government for CBBF. So when 6 districts, they were declared as CBBF corneal blindness backlog free. So he was honored at that time. So we are honored, Dr. Shakeen Singh, to declare you as a cornea hero.
Yeah, congratulations to Dr. Professor Shakeen Singh. I have long association with him, and he do excellent work. Particularly, he has done a lot of work in the field of eye donation and eye banking.
Yeah.
Congratulations.
Yeah, thank you, sir. Next. So he's Dr. Ramesh Kumar, a well-known figure in Ludhiana and around. He's medical director, Punajot Eye Bank, Ludhiana, Advanced Corneal Transplantation Center with NABH accreditation. His pioneering work in eye bank, eye banking at grassroots level in Punjab since 1991 is well recognized. Punajot Eye Bank has more than 7,700 corneal tissue collections to its credit, and he has performed more than 5,200 corneal transplantations, and all free of cost. So congratulations, Dr. Ramesh Kumar, and we are honored to declare you as a cornea hero.
Yeah, congratulations to Dr. Ramesh. He has done outstanding work in the field of keratoplasty and eye donation, and I know him for the last more than 30 years. And as it is, as in the biodata you said, more than 5,200 keratoplasty. Even he has lot of surplus cornea, which he offered to our institute also and others also. So congratulations to Dr. Ramesh.
Thank you, sir. Next. So Dr. Amit Gupta, he is Professor, Cornea, Cataract and Refractory Surgery Services, Advanced Eye Center, PGIMER at Chandigarh. His area of interest is femtosecond laser applications, LASIK, keratoplasty, Intex and cataract. Refractory cataract surgery, femtosecond laser assisted cornea transplantation. He has been invited for talks and presentations more than 160 times, and the international presentations 60, and publications, there are 75 publications to his credit. So we are honored, Dr. Amit, to have you as our cornea hero.
On my behalf, I know him very well for the last over 30 years. He focused everything onto cornea, and he has done a lot of work. He looks after our eye banking also, and now at present he is focusing on keratoplasty. Congratulations to Dr. Amit Gupta.
Thank you, sir. Next. So he's Professor Dr. Karamjit Singh. He did his MBBS in 1996 and MS in 1999. He is a professor of ophthalmology at Regional Institute of Ophthalmology, GMC Amritsar, and he has been performing cornea surgery since 2003. So I've known him from for almost maybe 10 years. He's a very hardworking young professor, and we are feeling honored to declare him as a cornea hero. Next.
Congratulations.
Please, mute kar lo, please. Yeah. Yes, sir.
Actually, congratulations to Professor Karamjit Singh. A lot of work he has done, and he's a young, dynamic person. And him also, I know more than 25 years, and lot of work and whatever, I think good work he is doing in a medical college, Amritsar. And congratulations, Dr. Karamjit.
Thank you, sir. Next. So Dr. Rohit Gupta, he's a very young eye surgeon, keratoplasty surgeon. He's director of Tri-City Eye Hospital, Mohali, and working as cornea and lens consultant in Guru Ka Langar Eye Hospital, Chandigarh. He did his post-graduation MS Ophthalmology and senior residency from PGI Chandigarh. He has an outstanding experience in optical and therapeutic penetrating and lamellar keratoplasty. He has multiple publications and researches in both international and national journals, including esteemed New England Journal of Medicine, and has been recipient of the Best Free Paper Award at IIRSI and DOS 2015. So congratulations, Dr. Rohit, and we feel honored.
Yeah, congratulations, Dr. Rohit. He is my student, and I think he was here in PGI for more than 6 years, and I know he does always outstanding work in the field. Congratulations, Dr. Rohit.
Thank you, sir. Next. So now I'll request Mr. Arun Verma to kindly introduce our guest of honor, Professor Dr. Jagat.
Thank you, Dr. Rakesh. I have been asked to introduce a eminent personality which requires no introduction. In fact, he is very popularly known in the country as well as an internationally renowned figure. He is most respected in his profession. He is the winner of many awards. I feel highly proud to introduce him. He is none other than Padma Shri Professor Dr. Jagat, an eminent ophthalmologist here, and is head Advanced Eye Center and director of Postgraduate Institute of Medical Education. He received the Oscar of Pediatric Ophthalmology at the World Congress at Pediatric Ophthalmology Strasbourg in Barcelona. He assumed the office of director at PGIMER in March 2017. He was conferred Padma Shri Award by the President of India in January 2019. In 2020, he has completed 41 years in the PGIMER. Sir, now I humbly request you to kindly deliver your keynote.
Yeah, thank you very much. I think it was excellent, outstanding keynote address by Professor Radhika Tandon. I know her for the last more than 30 years or so. She does outstanding work in this field, and I think no person is better than her, particularly in this field. And Dr. Rakesh Gupta, President and Director, SIPHER, Professor Sonu Goyal from Community Medicine, Vermaji, Harit Kaur, Dr. Ashok Sharma, Dr. Professor Shakeen Singh, Professor Karamjit Singh, Dr. Rohit Gupta, Dr. Ramesh, and friends. First of all, I will like to congratulate Dr. Rakesh Gupta and Professor Sonu Goyal for organizing this webinar for celebrating this virtual eye donation fortnight. This year, the eye donation fortnight is last year. It started on 25th of August and continued till 8th of September. In our country, the magnitude, as already said by Professor Radhika Tandon, magnitude of corneal blindness is very high, and few millions people have unilateral corneal blindness, and as many as 1.1 million people are blind due to corneal involvement, and they are waiting for keratoplasty. And there is only, I think, 30 to 40,000 keratoplasty each year. And additional 25 to 30,000 people are added to this backlog. Like the previous year, we could not organize the eye donation walk and series of lecture in the school and different location due to COVID pandemic 19. But we organize a webinar and video competition, painting competition for eye donation this year. It has also resulted in a marked decrease in the actual donation of the eyes. But recently, due to the help of forensic medicine here in PGI, we could get a few dozens of the eye from the medico-legal cases, but that was after following a proper procedure. I think very rightly said by Dr. Radhika Tandon that it is a teamwork. This is not just a single individual work, and where we need doctor, social worker, technical staff, and public involvement. and very rightly said that we have to focus on the rural area, particularly for the preventive aspect, and the hospital, particularly the urban area, for hospital retrieval program. There are a lot of superstition. I think we need not even tell, because people think that after in the next birth one may be blind. I think it is not right. There is a tremendous need to increase the eye donation in our country, which is possible in several ways. Every one of us can pledge to donate eyes, and irrespective of the age, sex, or even in presence of comorbidity, whether you are hypertensive or diabetic, or whether you are emmetropic, myopic, or hypermetropic. Key to success for eye donation is increase in the awareness, campaign, and engagement of the community, which is very, very crucial. I think today I urge you, all of you, to pledge for eye donation as well as for organ donation. We have to motivate others to pledge for eye donation, as well as motivate the actual eye donation at the time of death. We here in PGI, we take every patient wherever we receive the eye during this period. We take the sample and do the real-time RT-PCR or gene expert, and also the other routine test what we take from the blood for whether it is a HIV or hepatitis. That is whatever we used previously. But in addition, we are doing real-time PCR wherever we are taking, because you cannot presume anybody that he may be negative. So we have to rule out that whether he is COVID positive or negative. So again, once again, because I will not go long way, and once again I thank Dr. Rakesh Gupta and Professor Sonu Goyal for organizing this webinar on occasion of conclusion of 35th Eye Donation Fortnight 2020. I conclude reiterating my commitment to the cause of eye donation with the slogan Netradan Mahajan, Angdan Mahadam. Once again, I thank all of you for patience listening. Thank you very much.
Thanks a lot, sir. And we are obliged that you could spare so much time for us. And this is a token of love from us, an award of honor for your exemplary services towards this movement. So thank you, sir.
Thank you so
much. Dr. Sonu Goyal, I'll request you to kindly just give us some key learnings from this meeting. Dr. Sonu? Dr. Sonu, are you with us? Dr. Sonu? Okay, then we'll have a vote of thanks from Mr. Behel. Next, yeah. So Mr. Behel, he is from Eye Bank and Corneal Transplant Center, Hoshiarpur. He is the president. He has been helpful in performing over 2,300 cornea eye transplants since 1998 in the states of Haryana, Punjab, and UT Chandigarh, and increasing awareness in general population and children to donate eyes. Various government and NGOs, nationally, internationally, he has helped to raise funds for the cause and awareness. So I'll request Mr. Behel to propose a vote of thanks. Next.
Dr. Sonu Goyal is there. He can say a few words. He is unmuted.
Dr. Sonu?
Yeah, Dr. Sonu Goyal is
Are you with us?
Yes.
Yeah. Thank you, ma'am. Thank you.
Sir, let us know some key learnings from this meeting.
Yeah, thank you all. And first of all, I'd like to thank our chief guest and the guest of honors, Madam Vini Mahajan, our director PGI, Dr. Jagat, and the keynote speaker, Madam Radhika Tandon. So it has been the second time Madam Radhika Tandon has been with us, I saw her, I think, a year back when she came again in a similar function, which was organized by PGI in association with various partners. And she has been rightly said by Madam Mahajan, that she has been a guiding force for not only the state of Punjab, but also for many people in the country for this corneal backlog-free initiative. So thank you, ma'am, for being part of this initiative. And again, we hope that you can keep on continuing this type of motivation for all of us. I would like to thank, special thanks to Dr. Jagat, who has been always with us, not only whenever we call him on any public health event. So he has always been with us and has been a guiding, motivating force for all of us. Thank you, sir, for joining this event. It is our pleasure that you joined this event. I would like to thank our Mr. Bahel, who has been, I think, one of the non-governmental organizations who has been working immensely for eye donation in the state of Punjab. And as Dr. Rakesh Gupta has said, he has worked for donation since last 30 years for this particular campaign. So it's a very noble campaign. I would like to thank Mr. Bahel for being part of this very wonderful initiative. And lastly, I would like to thank our corneal heroes. And I am really privileged to see the CV and the work which they have done. And it's an immense knowledge which they all bestow here in this event. And I would like to thank each one of them by name. Really, they have been a force behind all the work which has been done in corneal blindness in this region. So thank you, special thanks to all 6 corneal heroes who have done wonderful work in this event. So as Dr. Madam Radhika Tandon and Dr. Jagat has said, that although it has been an increasing trend of eye donation over a period of time, but due to COVID situation, it has fallen down. So we need to rejuvenate this work. So, and some of the methods which both of them have suggested is pledging for donation of eyes, increasing awareness, like we need to have more campaigns, maybe virtual campaigns, which we can do. We can do some social media campaigns to promote eye donations on different social medias. And I think we can, if we are committed for it, we should be able to achieve the same levels as we are getting it before. And I really hope by inclusion of all of our corneal heroes and blessings of our Chief Secretary, Government of Punjab, Principal Secretary, Health, Government of Punjab, and Director, PGI Chandigarh, Dr. Jagat and Madam Radhika Tandon. So I think we should be able to make Punjab this corneal backlog-free Punjab. So thank you one and all. And I would like to say special thanks to Dr. Rakesh Gupta, who has been a motivating force behind this particular webinar. And he has not lost even a single penny of energy since he has retired or superannuated. So I used to say that he possesses more energy than we youngsters have. So I think thank you, sir, for for guiding force for all of us towards this wonderful initiative. And thank you all the team who has been behind this particular webinar, our team who has been working for last 1 week towards this webinar. So thank you one and all. And we will meet again in this similar type of social function.
Yeah, thank you, Dr. Sono. Now, I think we'll have a formal vote of thanks from Mr. Bahel, who has been part of from the organizing team, actually. He was part of the organizing team. So over to Mr. Bahel. Hanji Bahel sir.
Thank you very much, sir. Sir, आज जो दिन सेलिब्रेट हम कर रहे हैं, ये सिर्फ रेस्पेक्टेबल सीएस मैडम विनी महाजन की वजह से, क्योंकि 1998 से मैं इस मूवमेंट में चल रहा हूँ। 2015 तक कोई सेलिब्रेशन नहीं कभी देखी थी। मैडम 2015 में आए तो मैडम ने इस मूवमेंट में ऐसी जान डाल दी कि जिसकी बदौलत 2015 तक हमने सिर्फ 600 कार्डियोप्लास्टी की, जबकि आज तक हमने 3200 प्लस की है। ये सारा क्रेडिट मैडम विनी महाजन और राधिका टंडन जी को जाता है, जिनकी कोऑपरेशन और सर आपकी जो कोऑर्डिनेशन हमारे साथ बनी रही है, उसके लिए हम आप सबका बहुत आभारी हैं। और आज की मीटिंग में मैं थैंक्स करता हूं डॉक्टर जगत राम जी, डायरेक्टर पीजीआई, डॉक्टर हुसन लाल जी, डॉक्टर अरीत कौर जो हमारे स्टेट प्रोग्राम ऑफिसर है, जिनको जब हमने किसी एनजीओ ने भी अपने लिए कोई बताई प्रॉब्लम, उन्होंने इमीडिएटली उसके साथ सॉल्व किया। थैंक यू वेरी मच जी। और सभी कॉर्नियल हीरोज जो आज हमारे साथ खड़े हैं, और वो जो हमारे साथ नहीं लेकिन इस वक्त लाइन पे हमारे साथ जुड़े हुए हैं, मैं उन सबका धन्यवाद करता हूं। और साथ ही प्रभु का एक प्रार्थना करता हूं कि नेक्स्ट ईयर का जो प्रोग्राम फोर्टनाइट हो वो ऐसा ना हो, उसमें हम सब मिलजुल के इकट्ठे बैठ के सेलिब्रेट करें, ना कि ऐसे प्रोग्राम करके। थैंक यू वेरी मच।
So thank you, Balsa. So I think we can conclude the function now. Thank you everyone for joining us. Thanks a lot.